Dr. Linda Watson. I am currently the lead for person-centered care integration in CancerControl Alberta. My background, I've been an oncology nurse in the Calgary area for 25 years. I loved connecting with my patients and educating them and being a great nurse. But I began to get frustrated with some of the systems that seemed to make my work harder than it needed to be. So when I was in my master's degree, I tried to amass data and understanding through stories. The challenge of presenting that kind of data to the medical world when I was done was really the point that I understood that in order to really get the patient experience to be understood and on the same planning tables as clinical outcome data and pharmacological data, we needed to have a way to bring the common elements of everybody's stories forward in a way we could look at them together. And so screening for distress is a way for us to get patient experience and patient-reported outcome data on the clinical decision-making table. One of the biggest challenges that face clinicians every single day in every single clinical encounter is recognizing which patient needs what support at what time. So this tool first starts with the patient doing a self-reflective exercise to identify what's going on for me right now. Am I feeling nauseated? Am I having pain? Am I worried about my family? All of those things people have to tell us, help us understand. And we don't have a lot of time in our clinical environment because there is so many patients that need our care. And so this tool is a way for patients to do that kind of reflective work before they come into the clinic. If a patient fills all of that out and nobody looks at it, it has no value. The next step of the process really revolves around putting that tool and the things that the patient's prioritized in the middle of the conversation. It's not very efficient for me to start at the beginning with every patient. So starting where the patient's at is an efficient way for me to get the right information in the hands of the patient at the right time. So screening for distress has been a great example of bringing the stories and the experiences of patients to the center of our care experience by capturing symptom burden data, by being able to look at patient symptoms changing over time. We're going to be able to plan our clinical care teams more effectively. That is the next steps, is really harnessing the patient voice that they share with us through completing the screening for distress tool into a patient-reported outcomes strategy where we start to capture this data and use it. I am excited about the future. I feel like we are on the verge of shifting our culture, shifting the way we deliver care to every single patient in the province.